Welcome to the Gilman Wolsey podcast. This is episode number 14. We hope you enjoy the show. So today we're going to be talking about practical coronavirus protection for your family and friends. Something that we're seeing in the healthcare community that we want to talk about before we get into that is the infection that we're starting to see in healthcare workers, because obviously they're in the front lines. They use the personal protective equipment, or PPE, to help protect themselves. What are you seeing out there, Jackie?
Well, I'm seeing a lot of different things. And as I said, this is so rapid and we just don't have enough information yet to really grasp these true numbers with everything. But I do know Boston, last time I checked earlier today, had 3,200 cases of positive COVID and 160 infected workers. That's 5%. That's 5% of healthcare workers that are infected with this.
5% of the people infected are healthcare workers.
Yes, 5% out of those 3,200 cases are healthcare workers. And that's before the shortages. I mean, in Boston, they are, having to cut back on some stuff, only use certain supplies when it's absolutely necessary, given the circumstances. Like if you're in a situation where maybe you're just serving someone food, you're not going to use up a N95 mask if you're not going to be having direct contact with patients. So I think that they're trying to ration supplies where it's like higher risk, lower risk, so they can conserve as much as they can. But they're not even at a shortage level yet. And there's already 160 people that are infected. This is something that you see in Italy as well, and Spain. In Spain, they have over 64,000 cases right now. And out of those cases, about 15% of their healthcare workers are infected. You can see how, as the system gets overwhelmed and our supplies run low, the number of infected healthcare workers goes up. So it's kind of a correlation between the two. Right now, Spain has almost 10,000 healthcare workers infected. And it's scary. And I know at my own job, they were looking into us building or making our own mask if people had sewing machines in the hospital to start making them. And so I started kind of looking into this, and it's actually kind of funny because I live in an apartment, and the apartment complex gives us air filters every month for free, but they're not good quality at all. They're really you can't even tell if they're clean and dirty. Stuff just flies through. So I went on Amazon and I bought a whole bunch of MERV 11 filters. And then Gilman told me, he's like, MERV 13 are better. So I was like, oh, well, I want the best of the best because I have horrible allergies. And so I went online and I bought some MERV 13, but they were the wrong size. So I was like, I have this whole box of MERV 13 air filters. I can just tear the filters apart and maybe, sew the filter in between some material and make my own mask. So some protection is better than no protection. There's no full protection with even the N95 mask. I mean, you're still at risk. You're at less risk with it. But if everyone in the community was wearing face shields and masks and gloves and stuff every time they went out, I think the risk would probably reduce some.
Well, even in China, what we did see, part of their containment strategy, they actually recommended to the entire population to wear masks, and it was really twofold. So on one hand, what they wanted is that infected people would not spread it to other people as readily, but also the uninfected people, hopefully they wouldn't get it, they wouldn't touch their face. So they recommended for all the population, for everyone, to basically be wearing masks.
Yeah, because even though the masks don't provide a protective barrier from the virus getting through, if you have two people wearing masks and neither of them are completely protected, but it's not just the barrier, it's also about just having your whole face covered and everything else, because people touch their face all the time. I caught myself today, like messing with my eye, and it's just human nature. You have to kind of get into a pattern of reteaching yourself these habits that are not natural. I mean, when I was at work the other day, I was in line to get my N95 mask fit testing, and one of the doctors I work with came up there, and not even thinking about it, he was like, "Hey," and he like put his arm around me and gave me like a little half hug, and then he's like, "Oh shoot, I shouldn't have done that." It's just, it's not human nature to change everything. I mean, we're changing everything. We're changing how we, interact with people. We're changing how it's just like a constant thinking thing. And that's why Gilman has some very, very good tips and training for people who've never been in this situation about how to properly use PPE, take it on and off, things you can use. Like I said, you don't want to waste a lot of stuff, and you don't want to be time consuming all the time. I mean, there's certain measures where you have to use more or less precautions. Like if we're not going to touch anything going in and out to our car or in a grocery store, like you don't need the full garb. There's ways you can just do things quickly without wasting supplies. So I'm going to hand it over to Gilman, and he's going to talk to you guys more about this.
So first and foremost, it's important to understand that no measure that you take is going to be 100% effective all the time. The precautions that you choose to take are all about reducing risk. Even in the medical healthcare setting, there is no such thing as 100% risk elimination. It's all about decreasing the risk as much as possible. Depending on the type of risk that we have, we take more and more extreme measures, all the way up to the full hazmat suits that are basically like the space suits that you see people wearing. But that's not convenient in most settings because you have to undergo a full decontamination, and it's a lot of work to get in and out of it. So what I wanted to do today was really go through and describe, based on the medical principles that we use in the hospital, some things that you might be able to do for yourself, for your family, for your friends, that hopefully is going to help you provide some degree of protection for yourself and the ones that you love in the community itself. The first thing that I wanted to talk about was masks. I know that masks have been a really big topic. The CDC's been talking about it. The Surgeon General's been talking about it. And I would say, in my opinion, there's a little bit of misinformation, and it's been a little bit misleading what they've said, because they've come out and they've flat out said that masks are not effective for the general population. But that statement, the reason that I don't think it's entirely correct is because masks alone are significantly decreased in effectiveness. I think logically all of us can look at it and can say, well, if masks help healthcare providers, how can you say that masks aren't effective? Well, maybe they're only 10% effective, but even if they're 10% effective, I'm sure a lot of people, would want to wear a mask anyways. Now, what the mask is made up of course, gives you different degrees of protection, the most protective being an N95. But if you don't have that, you're still better off with something like a surgical mask than you are with nothing at all. So what about the masks can we do to wear it properly? First of all, we have to take into account when we remove the mask, what we want to do is either untie it from the back. We don't want to touch the front of the mask that we're breathing through, or grab the loop with your finger from behind your ear and remove it. The mask forms kind of like the beginning of your personal protective equipment, but if you want to have an additional or a more complete layer of protection, something that you can do is you can create, I guess, what you would call urban personal protective equipment. Now, this is something that's never been studied. This is purely like speculation and, on my part, kind of extrapolating or thinking based on what we're doing and figuring out ways to do it in the home, in the community. Essentially, what you've got to do is you've got to provide whole body coverage. So you want to be covered pretty much head to toe as much as you possibly can. You have things in your house to be able to do this. Ideally, you really want clothing that is relatively loose to begin with, because it's going to be much easier to remove it. The clothing also needs to be easily washable without destroying it, because you're going to want to wash it literally every single time that you go out to re-sanitize it. What I would recommend is something like sweatpants on the bottom. Maybe you have scrub bottoms if you have friends in the medical field, or very loose type pajama bottoms, stuff that's easy to get on and off. For the shirt, you probably want something like a long sleeve sweatshirt. Maybe you have like a track jacket with a zipper, something along those lines. It's probably not a bad idea to wear something like a hat or a beanie as well. When it comes to the shoes are always going to be a little problematic, because in the hospital setting, we actually wear shoe covers over our shoes every single case that we do, and then we dispose of them after. That's not really going to be practical for your own kind of urban personal protective equipment. And so to get around this, I've thought a lot about this, and probably a solution that would be relatively effective is if you had multiple pairs of shoes that you could cycle through. And when you came home, especially if you could leave them outside, ideally in the sunlight, they would basically kind of self-sanitize if they can be let to sit for a couple, 3 days between the time that you wear them and the time that you wear them again. We do know that sunshine and heat, sunshine because it has ultraviolet light in it, but those two things do tend to sanitize things over time. Part of the routine that you have to get into is, if you're going to wear like a protective outfit, you have to understand how to remove it effectively when you get home. The goal of removing it is that you don't spread stuff either within your house, or that you don't contaminate yourself by touching the outside of the clothing with something that otherwise is not contaminated at that moment in time. You've really, really got to think about it as there's the inside part and there's the outside part. The inside part is assumed clean. The outside part is assumed to be dirty. The barrier between the inside and the outside is really the layer of clothing that you do have on.
Yeah, he's completely right on. I scrub in for surgical procedures all the time, and I have to use sterile techniques. So I'm always having to be mindful, and it's hard. I remember when I first started out in my career, I was constantly thinking about, oh, am I going to contaminate myself, or am I going to contaminate this? And there were several times where I had to change my gloves like 10, 15 times. I remember a vascular surgeon who was very good at sterile technique made me re-scrub 5 times during one case because he thought I contaminated myself or something else. So it's something that's not easy to do. I mean, my best advice for a lot of people with this is, because I know a lot of people are freaking out, and I see this with like a lot of people. They are kind of wanting to like get in, get out, get fast. Like they're wanting to like, not be in public long and do stuff. So they're kind of hurrying, where when you really want to have good sterile technique, it takes time. Like you really have to kind of pause for a moment and think about what everything you're doing before you do it. Unless it's like for me with procedures now, it's second nature. I don't really have to think about it, but it took me a long time to get there. It's practice.
Right.
And I think if everyone just kind of slows down and thinks about like the situation before they do it, and like, would this contaminate me, or would this not? That's kind of how people have to start thinking.
Right. And one of the things is, Jackie talks about sterile technique. What we're doing here is actually what we would call contact isolation. The principles are the same. The difference is, in sterile technique, you're trying to protect the patient from the surgeon or the person involved in the procedure, because you don't want to give the patient an infection. In contact isolation, what you're trying to do is prevent whatever the patient has or whatever someone else has from actually infecting you. So
yeah, and like I said, we're all human here, and it's very hard because I'm very good at sterile technique and procedures, but it's very hard to break those social social habits that we have. Like I said, I had a doctor give me a half hug while I'm waiting in line to get my N95 mask of all places. And, it's really hard when you're so used to being a social population. And I think that's one of the things with Asian culture that I think this might be easier for some of them with, taking these measures, because a lot of different cultures in Asia are not as handsy or affectionate. Like Italians can be very affectionate, and a lot of people in the United States, and there's a lot of Spaniards. A lot of them are a very huggy, touchy-feely type of nation.
Well, just even today, because we were watching, they were doing the signing ceremony for the $2 trillion stimulus, and they've made this massive big deal of people social distancing, but they were all standing there shoulder to shoulder. And then as soon as the signing was over, Trump was handing out pins to a bunch of people, and then they were passing the pins between each other. I mean, this is an example. I mean, there's so many things that are socially just so ingrained in us that it's just, they're very, very hard habits to break. And even with putting on personal protective equipment, you'll find you have to, I mean, part of the value of suiting up is that it makes you, it makes you cognitively aware that something is different so that you can act in a different way. So one of the things that I do want to discuss, though, is once you are all suited up, how do you get out of that suit? Because Jackie can tell you, inside the hospitals, when you ungown, we actually have specific procedures to get stuff off so we don't contaminate ourselves in the process.
Yeah, well, with what I wear, it's a little different, because normally I do a technique where I grab the gown from the inside and I, cover myself with it. The cuffs of the gown are considered to be dirty. So we want to keep our hands without being in the cuffs. And then we use our hands inside the gown to open up the pack of gloves, and then we put on the gloves without having our hands full exposed. We kind of push our hands through the gown into the gloves, and that's called a open glove technique, I guess you can call it. And then we also do the closed glove, where someone actually gloves you. But these are, so when I rip off my gown at the end of a case, I actually usually rip off the gown, and then I just kind of pull the whole thing and pull my gloves off at the same time, only touching the inside of my gown. Other people will sometimes strip off their gloves first and then, rip off their gown. But I see people rip off their gloves first, and then they grab the outside of their gown and rip it off. And the front side of your gown could be contaminated. So some people use different techniques, but for me, that technique feels the cleanest.
Yeah, and in this particular case, if you're suiting up to go out into public to protect yourself, the way that I've kind of thought about it, that you could employ similar techniques to what we use in the hospital, has both to do with the order that you would undress and how you would do it. So when you're at the door and you're coming into, say, your apartment or house, while you have your gloves on still, I would take off your shoes and I would leave your shoes outside. After you have your shoes off, I would step inside and I would go directly to your laundry room. Ideally, the washing machine is already open, but that way you don't have to worry about contaminating the washing machine while you're putting stuff in. The first thing that I would remove while you still have your gloves on is your sweatpants or whatever loose-fitting pants that you have. To do this, you will grab only on the outside of the pants because you still have your gloves on. Remember the difference between inside and outside. You want to protect anything on the inside of the fabric as long as you have gloves on. So you'll strip off your pants, then you'll throw those in the washing machine. The next thing you want to do is strip off your beanie or your hat. And you'll do that also touching the outside because it's gloves to outside. You're going to pull off your hat. You're going to throw the hat into the washing machine. Now, if you do have,
Or if it's a baseball cap, you want to grab it from like the top. You don't want to grab it from the brim.
well, you could grab it from the brim because it's being washed. The point is
Yeah, if you're washing it.
yeah, what you don't want to have happen is you don't want to touch something that's on the inside and contaminate your head. You want to just be touching the item that you're removing. The next thing I would do is I would move on to the jacket or sweatshirt. If you have a jacket with a zipper, the first thing I would do is unzip it. If you don't have a zipper on it, before we remove the shirt, first we have to remove the gloves, because if we leave the gloves on first and we pull our gloves through the shirt, we're actually going to risk contaminating ourselves as we're pulling the gloves through. So take off your gloves, throw those in the washing machine. Then strip off your shirt. But now that your gloves are off, the only thing that you can touch is the inside. So you can slide your hands between the cuff and your skin and use that by hooking to pull off the different arms. And you'll have to figure out a technique that works for you. But remember, once your gloves are off, only touch the inside against your skin. Don't make any contact with the outside. Take your sweatshirt or your track jacket or whatever it is, throw that into the washing machine now. And now what you want to do is basically cycle the washing machine. And what I would recommend for that is the hottest setting with detergent, or if it won't destroy the clothing, you can even use bleach, because bleach is very sanitizing. And that should basically be a way that you can, say, wall yourself off from the outside world when you choose to go outside.
Yeah. Yeah. I mean, and it's something you have to think about all the time. But Gilman and I mean, like, we have to take out the trash, but even going out, I live in an apartment building. Well, we have a house and we have an apartment, but we're staying in the apartment right now. And even taking out the trash is, like a process. So we don't want to just like open the door to the trash, open the trash bin. We have a trash chute, and I mean, it's all metal and lots of people are touching it. So like, we don't want to waste supplies. So we actually have a glove. And we put on the glove, and when we're going to take out the trash, we have one clean hand and one dirty hand. And we'll pick up, and we'll use our dirty hand to touch everything. And then we will carefully, using that inside technique like we talked about, get the glove off our hand. And we have a Ziploc baggie we put it in, and we just like leave it out for a couple days. And we have a couple gloves that we cycle through. Or if we're just going to go down to the car and we need to go down the elevator, we might use like a piece of paper towel or a napkin or something just to use to push the button quick, so you're not using, like, you don't need full PPE to do everything in life. But if you're going to be like at Costco and you're really worried about heavy contamination and stuff, and you want to be fully suited, then these are some guidelines that you might want to use, or you might see as helpful.
Right. The intent of all of this is to match the degree of protection with the degree of exposure risk that we think that we have. Just like I was saying, is for a really infectious agent, sometimes we will throw on a full hazmat suit that has its own air supply, but that's overkill in a lot of different situations. One thing I do want to clarify is Jackie said dirty hand, clean hand. So the way that we define that is the hand with the glove is the dirty hand. The hand without the glove is the clean hand. So once we're outside of the apartment, when we're touching the trash chute, for instance, we use the gloved hand to do that. Since the trash came from inside the house itself, we actually handle the trash with the clean hand. Anything on the inside of the apartment, we touch with the clean hand. Anything on the outside, we touch with the dirty hand. And then we remove the glove from the dirty hand at the end of it. The reason that we put it in a baggie, however, is because we don't know what the long-term supply of gloves would be. And if you isolate stuff for several days, based on what the CDC has said, the virus is not very stable, and it actually will die on its own over time if it's not in a host. And so that's one way to basically sterilize, something, is just let it sit over, a prolonged period of time.
Especially if it's out in sunlight, the UV light will help with that sterilization process faster. So that's kind of what we've been doing. There's so many different ways. Like, I've been listening to a lot of different people on the news and other sources talking about different techniques they have for sterilizing things. One other thing too, before we and this podcast is, I don't know if this is proven yet. Gilman's telling me that it's not completely proven yet, but I've heard a lot of researchers and people from Harvard and other places talking about the use of ibuprofen and steroids and drugs in that category and contributing to the likelihood of leading to pneumonia and other making this virus more stronger. So can you elaborate more on that?
Well, actually, ibuprofen is a different class of drug than steroids are. Ibuprofen is what we call a non-steroidal anti-inflammatory. And right now, well, there's actually been a debate raging for years about the use of anti-inflammatory drugs like Advil or ibuprofen in settings where inflammation is important. So if someone breaks a bone, for instance, or if they have an infection, there's some people that have thought that not having your immune system be able to mount a good inflammatory response may inhibit your body from either healing or fighting off the infection. A while ago, I had a broken bone, and I actually studied this quite a bit because I was concerned about taking ibuprofen. And at least from the research I did, there was no absolute concrete answer. But what I would say is this. There is some concern about it, and we do have Tylenol that is very good at fighting fevers. I don't see any rational reason to be taking ibuprofen when Tylenol is available, and it's very good at what we call an antipyretic, meaning that it makes a fever go down. So I would recommend that you just not take ibuprofen, might as well just take Tylenol.
And with the steroids, I mean, some people need to be on them, and steroids aren't something you can just like cut off like immediately. So with the steroids, if you're on them, maybe talk with your healthcare professional about it. And if not necessary to be on them for like life-threatening condition or anything, maybe you can look at maybe tapering them off some or something.
And that's really a critical point when it comes to steroids. There's a few medications out there that can actually cause great harm if you stop them suddenly. Steroids are one of them, because once you start taking steroids, the steroid itself inhibits your own body's ability to create steroids. Your body actually creates steroids that are important to you. And if you just stop it suddenly, your body has been suppressed in the ability to produce those steroids, and it can throw you into a health crisis that can actually be deadly. So do not stop your steroids on your own. Consult with your doctor about it. If they think it's appropriate, they will tell you how to taper it sufficiently. When it comes to steroids, one other thing that I did want to touch on really quick, I have had several questions about inhaled steroids or steroids applied to the skin. Now, in both of these instances, I'm not a asthma allergy physician. So certainly they have more expertise in this area. But the research that I've been able to find, and the Allergy and Immunology Association, their belief on their website was that inhaled steroids stay in the lungs and they don't go throughout the rest of the body. And so the risk to the patient should be low. They actually give inhaled steroids with the nebulizer. That's the inhalers that people use when those type of people have normal respiratory infections. So you would think, based on that experience, that it should probably be safe. Again, talk to the doctor that gave it to you, consult with them, see if it's appropriate for you. For steroids applied to the skin, you would expect the same thing to be true. Some of it is absorbed into the bloodstream, but the majority of the action is actually at the skin where you apply it. And that's probably not going to have an effect on your entire body. It's probably going to be mostly localized to the skin itself. So again, you're always best, no matter what you're taking. Don't ever take information from a podcast or the internet. Always talk with your doctor and consult with them about what they think the best thing is for you personally in your care.
Yeah, well said. So, I mean, like we said, we're just relaying information. And like I told my family when I heard about ibuprofen and steroids and everything else, like I relayed the information to them because if they don't need to be on it, it's better not to be on it just to be safe. And everyone's looking out for their loved ones, their family. Like, this is so uncharted territory here that it's scary for everyone because it's so unknown. And we all just have to stick together. And I just like to relate any new information I get that could possibly help people. And that's what we're doing here. But we're not in any ways suggesting any medical direction to anyone.
And all of medicine is a balancing act because there's always risks and there's always benefits. Sometimes the risks change. Right now, because of the coronavirus pandemic that's going around, the risk profile of certain medications has changed. So maybe in the past where it was appropriate to be on a particular medication, in today's world, with the coronavirus in the community, there's new risks to consider. And that's why we say it's really important to talk to your doctor. And between the two of you, you can reassess and you can say, are the benefits now worth the risks that this particular medication poses? And if the answer is no, then you can figure out an effective way to get off of those medications and to, I guess, prepare yourself in case you happen to become infected. So,
well, there's a reason they call it practicing medicine. And through this pandemic, we've seen so much red tape cut because of this. And there's a lot of regulations in the U.S. and some for good cause. And, some maybe could be sped along to help some lives and help with other things. So we're not going to get into that. Maybe another discussion at another time. But this has just been, we really wanted to inform people about how to protect yourself, protect your families, and just make people kind of more aware. Like me being a healthcare provider, it's a little scary. It's like being a soldier on the front line. And right now, I'll just let everyone know, I was actually sent home from work a couple days ago because I was sniffling really bad and had a lot of congestion and stuff. And I mean, I'm sure you can tell it in my voice a little bit. My throat's a little scratchy, but it's allergy season here. And I don't know if it's allergies. I've been taking my temperature like every couple hours and I've been running higher, but still under fever temperature. And so I actually got sent home from work because they are worried about, me being a potential risk to employees. And it's just, I mean, the world's changing so fast.
And it's even nonsensical in a lot of ways because if you look at the symptom profile, runny nose is not high on the list of symptoms. It's a very vague symptom. And the irony is it's something, Jackie has had allergies for a long time. It's not uncommon for her to have a little bit of kind of a sniffly nose, when she goes to work, and it lasts for weeks at a time. It's just people are now hyper aware when they see you do that, and then they kind of freak out.
But you know what? I think they have every right to freak out. I work in surgery right now. As you know, all elective surgeries have been canceled for the most part throughout the nation. And I want to keep my coworkers safe. If they don't have a need for me because there's no cases, like it's best to take every precaution necessary to keep the sick away from the healthy. Because if I work in very tight quarters with my coworkers, and if I got sick, I could possibly infect the whole department and the whole department would be out, which would be detrimental. So I mean, in my opinion, I think it's best to take these safety precautions while we can. I mean, our hospital systems are somewhat intact still right now. I mean, like we said in other countries, there's people who are infected that are having to go to work to still care for people because they're so just running low and everyone's getting infected.
And well, it's a significant probability that's going to happen here as well. Right now, based on every indication that I see, we are at the beginning wave of this, not at the end wave of it. And this is one thing that is frustrating me a little bit with both how Trump, the administration, and some other people are talking. They're, at least from how I see it, they're projecting a little bit that we're kind of at the apex of the disease, that we're kind of seeing where we're at and we can make some assumptions. I think that it's very premature at this point in time to make any assumptions about how severe this disease is going to be. And we have to stay extremely vigilant at this point in time. Certainly, some of the policies that we put in place do have to be reconsidered, because we have to be careful of the economy, but taking care of people's health and lives, in my opinion, takes priority to some degree, because you can't get that health and lives back, but you can rebuild an economy when this is over.
Yeah. And I just want to give props to Trump. I know some of our listeners out there might not like him, but he's doing this. He's not taking a paycheck from this. He's not sleeping. He's he's taking phone calls all night. He's dealing with other countries. He literally had a pile of crap put into his hands that he's trying to deal with. And this is something no one's ever dealt with before. And no one really knows how to deal with it. I mean, everyone's kind of, because our numbers aren't matching up to China's or South Korea's. And it's like everyone's trying to figure out like the analytics of all this stuff, but no one really has a grasp on it yet. So like, it's really hard. And you have to realize that President Conte of Italy, he is taking care of 60 million people. I mean, the United States is huge. It's huge. And within the United States, every state runs things so differently. And that's like why I think it's really important for each state to really step up and be like, you know what? We need to just like take strict measures to contain this, because like trying to tell the whole country that you need to do this when California alone is the size of Spain. I mean, it's a lot. It's a lot. And I really hope that people encourage and step up to try to reach out to their governors and the people that can actually make changes in their state. Because like I know in Arizona, there is a petition going around from physicians to try to get signatures to put the state on a lockdown because they are worried about their healthcare workers.
I'm not so much a big believer in outsized federal government to begin with. So I like to see things pushed off to the states, because the governors and the mayors are closer to where stuff is happening. I think they can respond better and they can respond more appropriately. Maybe when they need help, reach out to the federal government, but I'm not really for a top-down approach at all to this. And I realize that it's going to mean that different places implement differences of technique, but in very rural areas, I don't think the same thing applies to, say, somewhere like New York with a large subway system. When I look at Trump personally, I'm not a big cheerleader of people in general. I'll point out what I like and I'll point out what I dislike. I do think that he has done several things that have been very good. There are some things that I have been very disappointed in, and I'm vocal about those. I don't like discussions to be political in general. But I think the federal government is part of the mix. Trump is part of the mix. And one of the things that we have to look at is we have to look at our politicians, and we have to decide, how believable what they're telling us is, how appropriate what they're telling us stuff is. And then ultimately every person has to make a decision for themselves based on what they see in their own communities and what they see going on around in the world. I listen to experts to try to get some baseline to be informed, but ultimately experts change their mind all the time. And so all of my assessments are not just copy paste from someone else. I look at all of the information around me and I try to draw rational conclusions based on what I'm seeing, not on what people are saying. To me, actions are everything, and talk is extremely cheap.
No, it is extremely cheap, and there's so much unknown out there. And this is like a whole nother podcast. I actually am thinking that maybe we should go ahead and wrap this podcast up, because I know it's been super long and I know people don't have a lot of time to listen to these like at a extended period. So why don't we make this we could maybe even do another one tonight where we kind of just delve into some of these things. I was talking to Gilman today about how I wish I was a reporter at these Corona task force briefings, because there's so many questions that are just not being asked that are like really crucial questions that people should be asking. So anyways, Gilman, do you have anything else?
No, I mean, the only other thing that I would really say at this point in time is I wish we had more direct access to the raw data that's coming out of New York and these other places, because it helps other people outside of the federal government. So there's not an inside group and an outside group. It makes it so people have a better view of what's actually going on. But other than that, I mean, I say we wrap it up.
Yeah. And I just want to say to all my friends and coworkers that are in healthcare, we are on the front line. I know I'm at home right now because everyone thinks I might be sick with the juju. But I know it's probably just a matter of time before I'm there with everyone and helping out when people do get infected and other stuff. And so, I mean, we're the soldiers in this, and I love all of you guys, and I want all of you to be safe, take care of your families. I know some of my friends are already being hit with this really hard on the East Coast. So everyone I love you and be safe.
Be safe. Have a good night. Thank you for listening to the Gilman Wolsey podcast. We hope you enjoyed our show. As always, if you have information that you would like to share with us, or if you would like to come on our show, please contact us at COVID at gilmanwolsey.com. We're always looking for new perspectives and to get an idea of what's going on out there. Thank you. Have a good night and be safe.